Assalamualaikum everyone, my name is Dr. Elizarina Samsudin. In this session, we will be going over the science of mental health and modern medicine, part 3, Pathophysiology, risk factors and signs of common mental disorders at work. In this session, we will go over how mental disorders arise and its risk factors and signs. It is hoped that by the end of the session, you will be able to, first, appreciate the complex multifactorial origin of mental disorders, second, explain the pathophysiology of common mental disorders at work, third, recognize the risk factors of common mental disorders at work, and fourth, identify the signs of common mental disorders among workers. Mental disorders are the result of complex interactions between brain chemistry, genetics, and environmental factors. These factors influence neurobiology and modify epigenetics of individuals during development and adulthood, thus influencing behavior. Genetic factors play a significant role in shaping individual differences in brain regions and neurotransmitter function that can influence susceptibility to mental disorders. This may be due to gene variations that affect brain structure or function, as well as genes involved in neurotransmitter synthesis, breakdown, or receptor activity, all of which can increase susceptibility to mental disorders. Mental disorders are not triggered by a change in a single gene. Scientists believe that the interaction of several genes may trigger mental disorders. Mental disorders known to have a genetic component include depression, anxiety disorders, and schizophrenia. Environmental factors such as stress also alter brain regions and disrupt neurotransmitter systems to increase the risk of mental disorders. For example, chronic stress can lead to dysregulation of the HPA axis, altering norepinephrine and serotonin signaling pathways, and increasing vulnerability to depression and anxiety. Environmental factors increasing the risk of mental disorders include head injury, poor nutrition, and exposure to toxins, including tobacco smoke, adverse childhood experiences such as parents' mental illness, family conflict, parents' criminality, abuse, neglect, and exposure to violence, as well as economic hardship and the death of a family member or close friend. Common mental disorders at work include anxiety disorder, depressive disorder, and post-traumatic stress disorder. Let us explore the first type of mental disorder common at work, anxiety disorders. Anxiety disorders are thought to arise from an overactive brain system in response to perceived threats, triggering the fight or flight response. It is linked to imbalance in neurotransmitter as well as hyperactive amygdala. Low serotonin activity in the amygdala reduces the brain's ability to inhibit the fight or flight response, leading to a hyperactive amygdala and subsequently heightened fear response. Meanwhile, low serotonin level in the prefrontal cortex impairs inhibitory control over fear, leading to exaggerated threat perception and worry. Finally, low serotonin in hippocampus lead to persistence of anxious memories. The risk factors for anxiety disorders are multiple and is caused by an interaction of genetic and psychosocial factors. Genetic predisposition interacts with situations that are stressful or traumatic to produce anxiety disorders. Anxiety disorders can be caused or triggered by factors such as medication effects, substance use or withdrawal, traumatic events, and negative or stressful childhood experiences. The risk of anxiety disorders increases with poor health and lifestyles, unsupportive workplace relationships, and high job demands. There may be several noticeable changes that are associated with anxiety disorders. First, workers may exhibit change in physical appearance, for example, loss or gain in weight. They may also exhibit change in mood, for example, being more irritable or tearful than normal. In terms of their work performance, they may display drop in work performance due to difficulty concentrating and reduced engagement. They may also have excessive missed work days due to physical symptoms such as migraines and upset stomach. The missed work days may be linked to stressful events at work, for example, project deadlines or critical tasks. Let us explore the second type of mental disorder common at work, depressive disorders. The underlying pathophysiology of depressive disorders has not been clearly defined. Current evidence points to a complex interaction between neurotransmitter availability and receptor regulation and sensitivity. A popular hypothesis to explain depressive disorder includes the monoamine hypothesis. In this hypothesis, diminished serotonin activity causes mood dysregulation, sleep disturbances, cognitive impairments, changes in appetite, fatigue, and suicidal ideation. Meanwhile, diminished dopamine activity, especially in the nucleus accumbens, lead to loss of pleasure. Finally, diminished dopamine activity in the prefrontal cortex and striatum causes poor motivation, attention and concentration, loss of energy, and psychomotor impairment. The risk factors of depressive disorders are multiple and include genetic susceptibility and environmental factors. Depressive disorders are 3 times more likely among individuals with family history of depression. Traumatic events such as the death or loss of a loved one, lack of social support, caregiver burden, financial problems, interpersonal difficulties, and conflicts are examples of stresses that can trigger depression. The risk of depressive disorders increases with work-related factors such as high job demand, low job control, poor social support, organizational injustice, and bullying. There may be several noticeable changes that are associated with depressive disorders. Workers who are depressed may appear fatigued and tend to exhibit loss or gain of weight, unkempt appearance, and poor hygiene. They may also exhibit change in mood, for example, cheerfulness, irritability, and uncharacteristic anger. In terms of their work performance may decline due to poor memory, trouble making decisions, and loss of self-confidence. Workers may also have frequent missed workdays due to illnesses or injuries. In severe cases, workers with depression may show signs of self-harm or suicidal thoughts. Finally, let us explore the third type of mental disorder common at work, post-traumatic stress disorder. When individuals are exposed to a traumatic event, they exhibit an initial response characterized by a surge of adrenaline from sympathetic nervous system stimulation. Physiologically, this can lead to raised heart rate, rising blood pressure, and further neuroendocrine responses, such as the release of cortisol and other catecholamines. When the trauma stimulus is prolonged or repeated, a conditioned behavior response leading to acute stress disorder or PTSD can occur. In individuals with PTSD, the toning down capacity of the frontal lobe is dysregulated compared to those without PTSD, and therefore amygdala's threat detection and fear response becomes dysregulated, leading to a hyperactive amygdala and heightened fear response. The risk factors for PTSD is multiple and include exposure to trauma. For example, exposure to actual or threatened death, serious injury, or sexual violence, especially for repeated traumas. The risk of PTSD after traumatic event is increased by several factors, including lower educational level, lower socioeconomic status, childhood adversity, gender, race, physical injury, severity of injury, history of mental disorder, occurrence of psychiatric symptoms at the time of the event, personality, and isolation or poor social support system. On the other hand, individuals who have a well-established support systems are less likely to develop PTSD after a traumatic event. The risk of PTSD is also closely associated with working conditions and interpersonal relationships. Among occupations, military workers and first responders have a higher odds of getting PTSD compared to other workers due to the nature of their work. There may be several noticeable changes that are associated with PTSD. Workers who have PTSD may appear fatigued or exhausted. In terms of mood, they may exhibit numbness and anxiety or panic attacks. They also tend to show behavioral changes such as hyperreactivity, avoidance behavior, self-isolation or social withdrawal, and engage in substance abuse. In terms of their work performance may decline due to lack of focus, missed workdays, reduced productivity, frequent accidents, injuries, or illnesses. These are the references for this slide, and thank you for your attention.